It's my great pleasure to welcome you to Des Moines Area Community College today and to the presentation by Senator Clinton on health care and health care reform. There is no better place to talk about health care than at a community college. As many of you know, community colleges, and DMACC in particular in this part of the state, train most of the health care workers for the hospitals and the clinics and the long-term care facilities. For those of you who had a terrible time finding a place to park today because of all the construction, the new building that's going up right over here is a new health sciences building, 15,000 square feet, that will allow us to expand our capacity by 30%. So we will be able to train many more nurses, respiratory therapists, med lab techs, and other kinds of healthcare professionals. So with that, I would like to once again welcome you to the college. Thank you so very much for your patience during these last couple of hours. It will certainly be well worth the wait. And if anyone has any questions about the new healthcare facility, come back in 18 months. It will be open and we'll be serving many more people. So it'll be just a couple more minutes. Thank you very much and welcome again.
Hi, everybody. Oh. Thank you all so much for being so unbelievably patient. I'm so sorry that I had a little problem with the plane that we chartered. I was in South Carolina yesterday and trying to get here. We had a little difficulty with the tires blowing out, and so they couldn't get it fixed, so that meant they had to send in another plane, which unfortunately took a lot longer than I hoped it would, and I really apologize, but I understand at least you got lunch. Oh, good. Okay. Well, it is such a pleasure to be back here at DMACC. I was here in 1993 talking about health care, and I'm back talking about health care because we're going to get it done this time. I was here back in 93 to have a conversation on health, and 14 years later, I'm a little older. I hope I'm a little wiser, but I'm still committed to universal health care. And we're going to talk about how to do that today, and we're going to hear from some people who understand in a very personal way why this has to be an important priority for our country. I want to thank President Rob Denson for his graciousness in hosting us here, and Kim Landuska, the Executive Vice President of the college. I want to also thank Sally Schroeder, who is the Dean of the College of Health here. And in a minute or two, I'm going to introduce our two panelists. Well, you know, part of why I came back here is to emphasize that we had a problem back in '93, and the problem has gotten worse, not better, because we haven't addressed it. You know, back in 1993, we had over 30 million people uninsured. Now we've got nearly 50 million uninsured. Back in 1993, we had a very high percentage, up in the 70% plus of people who got health care through their employers. Now it's down in the 60% plus. We've got 18,000 people a year who die because they don't have health care. I think that is so shocking in our country. You know, we pride ourselves on being such a compassionate country. We are certainly, by any measure, compared to the rest of the world, a wealthy country. But still, we have 18,000 people a year who die. This is a moral crisis and it's an economic crisis. And it's gotten so that you can't ignore it because it affects everybody. Back in '93, when I was here, I talked more about people who didn't have any health insurance. Today I'm talking about the two big problems we have, and I want to illustrate that by asking two questions. How many of you know someone who doesn't have any health insurance? Raise your hand. And how many of you know someone, and it could be you yourself, who has paid health insurance premiums, you've done everything you were supposed to do, and then when your doctor told you what you needed to keep yourself well or the surgery that was required, the health insurance company wouldn't pay for it. How many people know that experience? So you see, we have these two problems. It's not only people who lack health insurance completely, it's everybody who has it except when they really need it, and the insurance company says, just kidding, we're not going to pay for it. And look at what's happened in the last 7 years. Premiums have almost doubled. They've gone up 98%. And we also see how difficult it is for people who have insurance to actually afford to pay the bills that they incur. Half of all personal bankruptcies in America are because of medical bills. So this is a problem that cuts across the entire country and affects everybody. And unfortunately, our current president seems not to be aware of it or to ignore it. His only answer is something called health savings accounts. Now, what are those? They are accounts that you have to have money to afford, so the healthiest people and the wealthiest people get the best deal. But the sickest people and people in the middle class or working hard or poor, they don't get much help at all. And the president's biggest statement on health care was to veto health insurance for children. And you know, that is, to me, something that I never thought would happen. I've been working on behalf of kids for more than 35 years. I never thought we'd have a president who would veto bipartisan, paid-for health care for kids from working families. You know, if you're poor enough, you get Medicaid. But if you're working and you don't have money or your employer doesn't help you, you're out of luck. And these were the people we're trying to help. Because we have 9 million of the 47 million Americans without health insurance who are children. So it's no wonder that people feel like they're invisible when it comes to their health care needs. People like the woman I met from LeClaire. She and her husband both work. They can't afford health insurance. They had to end up selling half of their family farm to pay their medical bills. People like the mother from Greenville whose daughter got sick but didn't have any health insurance. And she died a year later at the age of 18. And when she died, the death certificate had no cause of death because her illness had never been properly diagnosed. I know so many people here in Iowa and across the country who are desperate for change, and we have to make that change. That is what this election is about to me. It's about making the changes that Americans and America need and deserve. That's been my focus ever since the early 1980s, when I helped to expand health care in rural Arkansas. And back in 93 and 94, I took on the drug companies and the insurance companies, and we weren't successful, and I was terribly disappointed, but I didn't give up, because I believe that you're really tested when something doesn't work out, when you meet a roadblock, whether you get up and keep going or not. And what's great about Americans is we learn from what doesn't work, and then we get up and keep going and make it happen. And that's what we're going to do about health care. And when I'm president, we're finally going to have affordable, quality health care for everyone. When I started this, I had the benefit of some of the lessons that I've learned. And after we didn't succeed in 93 and 94, I took on the drug companies to make sure they tested drugs that were prescribed for children. Surprisingly, until very recently, drugs were given to kids based on guesswork because nobody tested them on children. And you know what? Children are not just little adults. They function differently. They have different needs. So we worked, and I finally got through requirements that you had to test the drugs on kids if they were going to be prescribed to kids. Then in 1997, I joined forces with members of Congress, and we passed the state children's health insurance program. And then in the Senate, I've worked to get health care for our National Guard and Reserves, because surprisingly, they didn't have it when they were called up, beginning in Afghanistan and then in Iraq. And we've worked to lower drug prices for seniors and to get health care for all those first responders who were sick. Now, my health care plan is informed by this long experience. It starts by reducing costs. More than anybody else in this race, I have a plan to reduce the cost of health care by $120 billion a year. And I think it's important that we understand